This is the Shoulder+10 program presented by Physical Rehabilitation Services. It's the 10 best evidence-based exercises designed to improve shoulder girdle strength and rotator cuff strength. All exercises are performed in a superset utilizing a challenging weight for 10 repetitions for a sedentary or untrained individual and 3 sets of 10 for a trained or physically active individual. The exercises are designed to strengthen the agonist and antagonist muscle groups in the shoulder without rest between sets. And all of these exercises should be performed at least 2 to 3 times per week. Okay, so first is shoulder external rotation. And as you can see here, Josh is externally rotating the arm, making sure to keep the elbow bent to 90 degrees. And as he's doing this, he's going slightly uphill. Also, you'll note there is a small pillow or bolster underneath the arm. And the reason for that is to gently depress the bolster against the ribs, and it opens up the subacromial space and allows for proper shoulder external rotation. And next is shoulder internal rotation. You can see he's internally rotating the arm, also keeping sure a 90-degree bend at the elbow, depressing the bolster against the ribs, maintaining a smooth, controlled motion. Okay, next is bicep curls, and this can be done in a variety of ways. This is just one example. You can use dumbbells, you can use a cable column, you can do one at a time, both at the same time, barbell, whatever it may be. Smooth, controlled motion, slowly flexing the elbow, working through full range of motion. Next is a tricep extension, and this is just one example of a tricep strengthening exercise you can do. He's bent over at the waist, slowly extending against gravity. The next exercise is forward shoulder flexion, and the patient slowly elevates the shoulders to about 90 degrees against gravity, smooth, controlled motion. And the next exercise is scapular depression, and you can see in this exercise the patient will have his or her feet supported, and it's best to use a dumbbell to relieve some of the pressure on the knuckles as you're depressing the shoulders. And also you'll note you're retracting or squeezing your shoulder blades together as you press down. The next exercise is scaption, and what the patient will do is slowly elevate the arms, not in the frontal plane, directly out front or directly out to the side, but in the plane in between. And you're taking the dumbbells from the hips up to shoulder level and down slowly. Next exercise is rowing or scapular retraction. And this is just one example of a variety of ways how this exercise can be performed. You can use a TheraBand, cable column, etc. And basically you're rowing back, squeezing the shoulder blades together in a smooth, controlled motion. The next exercise is prone abduction or retraction, lying on your stomach. And basically in this position you're taking the arms straight out horizontally with the shoulders elevating, slight pause at the top and back down. The next exercise is the push-up with the plus, and in this position the patient does a full push-up from the ground, slow, smooth, controlled motion, and at the top give an extra punch or plus, further rounding off the shoulder blades. And finally are the last 2 stretches of the Shoulder+10. First is the sleeper stretch, and in this position the patient is side lying, but you can see not directly lying on the shoulder, more so lying on the scapula or shoulder blade, maintaining a 90-degree bend at the elbow and slowly depressing the hand to the table, holding for 30 seconds and releasing. This can be performed 5 repetitions. The next stretch is the cross arm stretch. This also can be performed in a side lying position, again taking care not to lie directly on the shoulder, but more so on the scapula or shoulder blade, and you're pulling the elbow directly across the body until a stretch is felt in the back of the shoulder. Again, this is a 30-second hold for 5 repetitions.